Thank you, Laska Hirlock. I'd like to welcome Minister Shortall to the Shannon Chamber today, and thank you for taking the time. I'd also like to congratulate Professor Crown, excuse me, I have a cold, congratulate Professor Crown on an excellent speech. I just wish the gallery was full, I wish the chamber was full to hear such an excellent speech, and I must say I feel standing up after you. I think you've really brought the case home very clearly. I am, as I think I've said before, I am from Dundalk, and as a child growing up in Dundalk, I can remember the significant cultural and sociological influences that multinationals like PJ Carroll's, who had their home in Dundalk and were the largest tobacco distributors in Ireland, and the former Harp Brewery had on the community of my hometown. In particular, I can remember on Fridays when employees from the aforementioned companies were the beneficiaries of free cigarettes and free alcohol for their own personal consumption. Dundalk must have been a great town to live in. These were given out willy-nilly, notwithstanding the long-term consequences for the beneficiaries' health and indeed the health service. Now, I think that culture has kind of changed today. PJ Carroll's have closed down, and I'm delighted to see that the former PJ Carroll factory, the home of the music department of DKIT. The Minister and other senators have pointed out the absolutely frightening statistics on smoking, and I think we've all been, reading up on it and come up with the same statistics, that smoking is the greatest single cause of preventable illness and premature death in Ireland, killing over 7,000 people a year. And I think, this is the whole point of it, that we can talk today and give out all the statistics and all the facts, but what we're trying to do today is to introduce the graphics to go along with these words, and to, I think that this will highlight and impact on the severity and the awful consequences of smoking. 90% of lung cancers are caused by smoking. 50% of all smokers will die from smoking-related diseases. Smokers have an increased risk of cancers, as Professor Crown has pointed out, heart disease, strokes. Women smokers have a greater risk of delivering babies with low birth weight, bronchitis, emphysema, and many other diseases. Smoking is the single most important preventable cause of illness and death, and smokers, as we said, lose an average of 10 to 15 years from their life expectancy. The cost of smoking in terms of damage to health and well-being are far outweigh the economic costs of tobacco use. Smoking costs the Irish economy at least €1 billion a day in lost productivity, which is frightening. It costs us €1 billion per year to provide health services for smokers. If we don't make reducing the impact of tobacco in the next 10 years, it will cost our already overburdened health service in excess of €23 billion, as the Minister has said. This would pay for the entire cost of running our health service for almost 2 years, or indeed go a long way towards building our new National Children's Hospital. In my opinion, the introduction of this combined photo and text warning will, in the long term, reduce the number of people who smoke, so that the Irish economy can reap tangible benefits in both social and economic terms. We're all familiar with government health text warnings that have been on cigarette packaging for several years, which are effective due to the frequency of exposure. As has already been said, a person who smokes 20 cigarettes a day is potentially exposed to the health warning 7,300 times a year. And the location of the warning on the packet means that it is visible to the smoker every time he opens a packet of cigarettes. Developing this idea of text and showing a picture of a smoker or a diseased lung, or any of the pictures proposed to be included as part of the pictorial campaign every time he lights up, can only increase the exposure of the health risks of smoking and thereby act as a deterrent. The most recent large-scale report on smoking in Ireland, the report's titled Slán, reported a slight increase in the number of smokers, which was surprising. For me, I thought the number was coming down, but it has actually increased very slightly from 27% in 2002 to 29% in 2007. Despite the text health warnings on cigarette packagings and the introduction of the non-smoking ban in public places in 2004. Another worrying trend to emerge from this report is the increase in recent years of the number of young adolescent girls who smoke. And I think, we're all in agreement on this, that this is vital. As you've said, it's vital that we catch the young people. This is when they're most likely to become addicted. Speaking with the Irish Cancer Society, they have reported that they are losing the battle with young girls. The numbers of young girls are actually increasing, the number of young girls who are taking up smoking. As a parent of teenage children myself, the age when a child is most likely to succumb to the temptation of smoking, I've been heartened to see reference, albeit a small one, to the dangers of smoking included in the Junior Cert SPHE curriculum textbooks. And I think this is one area where we can target our young people. Most schools, I think now, do have an anti-smoking policy, but I think we could go a lot further. On asking my own children last night when I was preparing for the speech, I asked them, could I see their SPHBE books? Did they cover it? There were 4 pages of text in their books, 1 picture. The picture was of the lung of a smoker, and each of the 4 of them were unanimous that the picture had a much greater impact on them, and they would consider it to be a far greater deterrent than the 4 pages of text, which I think would be the same across most teenagers. There are, in my opinion, many reasons that justify the need to inform smokers of the health risks of smoking through the use of pictorial warnings on tobacco products. First of all, a picture is without doubt eye-catching. As the saying goes, a picture paints 1,000 words. And today, I've photocopied out the 14 pictures, just to pass along, of the proposed to put on the cigarette packages. And I think, it is true that a picture does paint. Sorry. Thank you. That the general and it goes that the general belief that an image can be more powerful than words on a page. This is proven time after time, especially when children who have no speech, or adults who have lost their speech through strokes or illness and who learn to communicate very effectively. And I've seen this myself with children who cannot speak but who can communicate so effectively through picture signing. A picture also crosses the barrier of language. We can all go abroad and read a health warning in a foreign language and have an idea of the message, but a picture doesn't need translation. Pictures are also informative. Research in 4 countries showed that in Canada, where pictorial warnings include information about the risks of impotence, smokers were almost 3 times more likely to agree that smoking causes impotence, compared to smokers from America, United Kingdom and Australia. In the same study, 44% of smokers in Canada said that the pictorial increased their motivation to quit smoking. Pictorial health warnings on packages make the product look less attractive and target smokers by detailing the health risks of smoking. It's also vital to remember that the introduction of pictorial warnings, as my colleague has said, will have absolutely no additional financial costs to the Exchequer, and again, I think that is vital. We all know that the adolescent years can be the most vulnerable, therefore it is imperative to target this age group when addressing the dangers of smoking. The effectiveness of colour graphic warnings over other illustrations was highlighted in an EU directive of the European Parliament in Greece in 2003, where 96.1% of current smoking adolescents opted for the graphic warning labels as being more effective in preventing them from smoking and more effective in informing them about the health effects of smoking. Thank you. In comparison to the EU text-only warnings. It was also noted that younger adolescents up to the age of 14 not only opted for the graphic warnings more often, but were also more likely to rate them much higher in comparison to their elder peers of 15 plus. In conclusion, the proposed EU graphic warning labels, supported by other tobacco control policy interventions such as the smoke-free environments, the advertising bans and increasing the price of cigarettes, must play a vital role in denormalising smoking and preventing smoking initiation, especially during the crucial years of adolescence when smoking experimentations and addictions are more likely. I recommend this bill to the House. Thank you.